Well, first, I think it's important to say that, we see kids from 5 years old to adults in their 60s and 70s. So we can see throughout the lifespan, depending on when the need arises. As far as our specialties, we are a trauma-informed organization. So we address all of our services through that trauma-informed lens, meaning that a lot of the clientele that we see have had adverse childhood experiences or they've had previous trauma. And that is something that we can work with. One of the things that we see a lot of, especially now, is a lot of depression, anxiety, and self-harming behaviors in our youth in particular. We can help with that. We can help with school behavioral problems. We can help with issues or barriers to getting services, for autism or for ADHD or whatever it is. We cover a very wide range of services. And if we don't specialize in it, then we refer and get them connected to where they need to be.
That's good. So if you don't have someone that particularly serves that specific need, that's part of your services is making that connection with.
Correct.
That's excellent. Thank you.
Yes. We'll send out referrals and connect with the agencies and get them connected together.
So, Hannah, with these services that you have, what insurance providers do you accept?
So we accept Medicaid, and we accept private insurance, and that can look like Anthem, Humana, and just to kind of piggyback off that, we do have payment plans that we offer as well. So if money is a concern, that's something that we absolutely work with families on to ensure that it's not a financial burden for them to get help. So we work with them to determine a payment plan that works for them.
And that could definitely help a lot of people in this area that have more financial struggles.
Yes.
And especially in the kind of state that we're at now, finances can be very difficult or a burden for some of those
Absolutely.
services. So it's, encouraging those who, may not think that they can afford these services, knowing that there are resources that can help them.
Absolutely. And I would say one of the barriers that was noticed prior to Grant County being opened was we were getting feedback from clients that were needing the help and driving up to northern Kentucky, which ended up being a financial strain for gas purposes, transportation.
Taking off work because it takes even longer to get there. Yeah.
Yes.
Just reliable transportation to begin with, right?
Yes. So that is one of the barriers we've been able to address of that gap in care, not being able to get to the location. And even if they can get to this location, we're offering the telehealth option so that they don't have to leave the comfort of their homes. They can have access to services in their home as well.
So what is the current wait list situation? Is there a wait list for certain services?
So we do currently have a wait list for our individual and family therapy. We're looking probably at a couple months out right now, but as far as our intensive outpatient services in our schools and targeted case management and medication management, we currently do not have a wait for that. So if it is determined based on the assessment that a client should get individual or family therapy, we'll typically go ahead and get them connected with targeted case management in the meantime while they wait.
Okay.
So they're
not
never
just-
without services.
Right. Okay, that's good.
Yeah, that's been an issue for, even myself in the past, having, even going through personal crisis and feeling like there's nothing you can do because the soonest available is 2 months.
Right.
So being able to contact you all, people should still feel like they can